Welcome back to another episode of The Expert Approach. I'm your host, Joy Maulik, a urology nurse practitioner. Here, we bring together voices that are shaping the future of urology and uro-oncology, along with redefining the role of advanced practice providers. Our goal is simple: to find the purpose and insights that sparks a positive change. Today, we have a truly exceptional guest joining us. Her name is Tricia Zubert, a board-certified nurse practitioner and a leading expert in sexual health and male infertility. With over 18 years of experience at Park Nicollet Health Services in Minneapolis. Tricia has been an integral part of multidisciplinary care team in sexual medicine. She has earned her Master's of Science from St. Catherine University and has been an active member of several esteemed organizations. Now, to name a few: American Urologic Association, Sexual Medicine Society of North America, and the American Society of Reproductive Medicine. She is not only a practitioner, but also a passionate educator and have great speaking engagements, having trained residents, authored many journal articles, and presented both nationally and internationally on the topics related to sexual health and infertility. She is a leader within our KPP community, serving various committees within the AUA, including co-directing their annual program for APP. Today, she is here to share her insights in the areas of sexual health and fertility. Tricia, thank you so much for joining us today.
Hey, Joy, thanks for having me today. An honor.
Thank you. So I have to start by saying that, when I or many of us think of urology, fertility doesn't pop up, but you have made a career out of it, almost 2 decades. So what how did this journey start, this remarkable career that you have had? If you can share how it began, what barriers or turning points that kind of shaped the path that you have taken so far. And looking back today, I really want to know, after almost 2 decades, what keeps that spark going for you? Can you reflect a little bit on that for us?
Absolutely. Those are great questions. So, about 20 years ago, I was working in family medicine and had my second child. And I decided to take 2 years off just because they grow very fast. And after that 2 years, I was thinking, I need to get back into medicine and I need to do something with my brain again, even though I love my children greatly. So I decided family medicine was no longer a fit for me. It was just really long hours. So I did interview for a position in endocrinology as well as sexual medicine. And I did get the job offers for both, but I chose sexual medicine. And the reason is that I knew the urologist that ran the clinic, but also another colleague was in that clinic too. And he said, you really should come and work with us. You could be a national speaker. And this is cutting edge information, and things are changing rapidly. So I think this would be really a great fit for you. You kind of have to have a certain personality to be in this field, right? You have to kind of fit each person. I kind of see it as a dance. You have to kind of figure out how that patient is. Are they having a good day? Are they serious and crying? And just kind of meet each patient where they're at. And I have not looked back because every patient I see is, I don't know, it's just fun to see and to be able to help them. So this is such a rewarding field to be in.
No, and the part that you said, it really takes a special person to be there, because if I just take the fertility part of it, most of us want to have something, and what better than a joy of new life coming into this world. And to have that empathy, understanding the challenges, the psychological part that they go through, both the partners, and that truly is amazing. So when you have this is off the cuff a question I have for you. So when you see couples, who are more nervous, men or women?
That's a great question. Often they come in together, and usually the female partner will make the appointment. So I would say sometimes the males are nervous because they're talking about a topic that is obviously really, really sensitive and not used to talking about this. But and the females too. I mean, obviously they're just trying to achieve their goal of obtaining, like you said, that child, that gift.
And it's true because, that is such an intimate part of your personal life that you're sharing. But thank you for being a part of that journey for so many families. So, my next question would be that in healthcare, really, it takes a village to build something strong and powerful and meaningful, right? So can you give me an overview of who you collaborate with, physicians or other colleagues or other providers, and give me a sense behind the scene how this thing works?
Yes. I wanted to tell you the journey of our clinic. It started about 45 years ago. It came out of International Diabetes Center when they actually realized there was a connection with diabetes and erectile dysfunction. So actually, a nurse practitioner and a psychologist started the clinic 45 years ago. And I believe we were like one of the first in the nation to have that combination together. So through the years, we grew. And actually, about 8 years ago, we hired our director, a urologist, and an andrologist. And that is how he had brought in the male infertility at that point. So that's how we got all three of those under one roof. As far as collaboration, again, we are so lucky. We have the director, like I said, who is a urologist, andrologist. He's actually our only urologist in our clinic. We have one physician who is a family medicine physician and previously a hospitalist. And then we have 4 APPs and 5 therapists that are all in-house. So we always work together. And you wanted to know about collaboration? Is that what you're asking? Yeah. We can go down the hallway and, if I'm sharing a patient with one of the psychologists, I can say, hey, what are you seeing in this patient? I'm just trying to get your perspective too, because we are trying to get this patient to their goal that they want to achieve. We also, my director called me a couple weeks ago and asked me a female sexual health question that he didn't know. So it's not necessarily a hierarchy. It's all, like you said, we're all a team trying to grow and help as many people as we can. We also have journal clubs once a month, which each of us will lead. And that could be an important journal topic or article that you thought was amazing. Or it can be a book. I recommended a book one time. We can have speakers come in, or you can actually do a presentation. But that way we're all collaborating once a month and learning something new at the same time. So I think we're getting stronger, and I love that communication and that collaboration, because it does, like you said, take a village to make something really good.
Yeah, and like what this journal club is so creative. It's kind of like you are learning, but that feels like fun, right? It's not like a day-to-day thing. So my natural curiosity goes in because, of course, I am not in your space. But in my space, I have seen that genetics have played some role in prostate cancer and even in other GU cancers. So, does genetics, do you guys refer them to some counselors if they need it? Does genetics even have any role in fertility or?
Oh, yes. Genetics definitely has a role. If someone has azoospermia or oligospermia, then we are doing some genetic testing to see what's going on. And often we will refer. We actually are so fortunate we have a genetic counselors in our system. So often we will refer them to the genetic counselor, and then they will get back to us and trying to figure out and give us more information about what is happening.
And that probably is good too, because when their kids are growing up, they know there is something they can be proactive in that
Right.
sense. I would assume, right?
Right. That they're aware of what what their genes are carrying, right? And take
Yeah.
precautions or just have that knowledge of,
Right.
that with their offspring. Yeah.
So 45 years your clinic has been there. You have been apart for 18 years.
Yes.
Do you see a technological advancement that has come into this field than when you first started and now?
Well, yeah, I'm trying to think. We switched over. I'm sure a lot of people switched over to Epic. I remember in
Yeah.
2009. That was a huge technological change. But yeah, I don't know. I think that there's a lot more things coming down the road as far as, um, you know, male sexual health. I know for sure, like maybe plasma injections or shockwave therapy. I think we're still haven't found a lot of the treatments yet, and it's still experimental, but I think there will be in the future. I know that we're doing things for females, a lot of advancements with that. I think that they were being a little bit more aware of if there's some skin changes on women. I actually do something, believe it or not, called license of clitoral adhesions, which we never knew about that like 5 years ago. Yeah. And that could be life changing for some of my patients. Obviously, test Capel, that come along. And also too, Mona Lisa touch laser. So we do a lot of things. And then a couple of my colleagues go into or I do not. My boss would like me to be doing the procedures of being seeing patients in the clinic along with my other physician that I work with. So yeah, I think that there'll be more, and I'm excited to see what the cutting edge things that are. I feel like it's maybe moving a little bit faster right now with the females, but I could be wrong because there hasn't been a lot of studies on females throughout the years, and there's starting to be a little bit more focus on that, which is exciting.
Oh, yeah, which is good because, anytime we think of sexual health, we always think of erectile dysfunction, right? Males, and this medicines, the PD5Is that have been for so long. But this is good, what you brought in was something important because body image does play a role. So if something is preventing a woman from being intimate with their partner or something that does not feel comfortable, I am sure these new innovations are only helping them to be more for themselves, and the relationship is developing from that. Does that resonate?
Yeah, I think that you're right on a lot of things that you just stated. A lot of women say, "Well, there's like what 25 medications for men. What is there for me?" And they want and I say, "Oh, I have a lot of arsenal of things that we can do." And body image, like you said, also does play a role in women. Often they come in and they cry. They feel like they tell you that I feel broken, something's wrong with me, and they feel abnormal. So, yeah, when we're looking at men and women, we are looking at each individual as a whole. So I'm going to be looking at them emotionally, cognitively, their relationships, spiritually, and physically too. So yeah, I like what you say. It's a lot more than just the medicine. It's looking at the whole being.
Yeah, because I do some men's sexual health, and I do the Peyronie's disease and the Xiaflexes. So from the male perspective, I have seen with that curvature, or somehow they don't feel as confident.
Yes,
And my thing is that this is my line, that if your mind is in Alaska and the body is in Florida, generally it doesn't go anywhere, because
yes,
the
yes.
head office has to be in sync with the rest of the satellites, right?
Yes, yes. We always say the brain is the biggest sex organ, but yes, you're right. If there's with men, that Peyronie's definitely can play a role on the psychological part of them, and they feel broken too. I've had men cry because of that as well. So yeah, that's what like kind of hits the inner core of who they are. It's yeah, and it's an honor to be in that space to be able to help them and listen to them, right, and be a support to them.
And see, that's the reason you are such an excelling person in this field because your passion shows through when you talk, because sometimes it's not what we say, but the body language and our semantics shows, and it shows that you care about your patients. I have to go back because, again, for the prostate cancer, and I've seen testicular cancers, right? So sometimes, as we know, testicular cancer hits younger men.
Yeah.
And sometimes, if young men are diagnosed with prostate cancer, which we are seeing, do you ever get patients that they know that the treatment can impact fertility and they want to bank sperms or something of that sort?
Right. We do. We do. I think, I don't see a lot of that just because when that happens,
Yeah.
my director wants to be on it and
Yeah.
will work them in because this is something that's time sensitive, right? They may need to start chemotherapy within a week. So we don't have time to wait. So he'll usually make an exception and pull them in. I see more of the prostate cancer prior to, hopefully, surgery or radiation, and then afterwards, obviously, with the penile rehabilitation. But yeah, we definitely take that very seriously in our clinic. That's an important thing that I think a lot of people don't always address or are aware of that. They're thinking about, let's get rid of that cancer. And this is an important part of people's life, right? So we
Yes.
do need to stop and take that time and make sure they're getting what they need, or just give them options
Yeah.
of what they can do with that sperm banking or whatever they need.
And that's true because I hope that this will bring that awareness, because when a person hears that word cancer, everything else stops, right? Because
Yeah.
then their mind is, how can I beat this cancer? But what you just mentioned, it's so important, because not only for the patient but for providers, that we need to counsel them to know that, hey, you might want to plan, because today or tomorrow, innovations are good. You're going to beat this cancer. But let's plan. Let's get your significant other here and see how you can have a productive life still ahead, and just kind of survive the cancer the right way.
Yeah.
That's so, I am going to now go into the APPs and sexual medicine, because you said 4 of your APPs are in your clinic, and you have seen firsthand how an APP started this, and now you have evolved into this team. So, so tell me that not just men's health, but women's health, and as we know that menopause, fertility care, and other perspectives, how have APPs role changed over years? How are you supporting the community that you're serving? And what are the things that people who don't do that should be looking forward to referring patient to specialists like you?
Oh, yeah. Well, I'm trying to save one each starfish each time, right? Throw back in the ocean. I feel like there's a lot of work to be done. I would say, actually, since I've started at this clinic, I have always been the one who does the consults, the follow-ups, all the ordering and everything. And I would say that my colleagues do the same thing. So we really take the bull by the horn. We do it all. And my director, he doesn't want to be necessarily doing all that. He wants to be doing procedures in the OR. And honestly, that's where he's going to make money, and that's how it's going to make our clinic successful. So we are doing. He's like, I haven't seen a consult in a long time. I was just talking to him the other day. So we actually do a lot of the work, to the point that we will often even tee patients up for surgery. And so sometimes they are meeting him for the first time at the hospital, and he trusts us enough and to get everything ready for him to go. And so that he can do what he loves to do. So yeah, did that answer your question, Toria?
No, yes, definitely it does, because it seems like from your, team approach, there is a collegial relationship that you guys have developed. There is a trust. And the other thing is, everybody is practicing at the top of their licensure.
Correct.
So that, because I think when that happens, it prevents delay of care.
Yes.
It puts the right person with the right provider
Yep.
that they can help. and then you guys are kind of co-navigating that journey of that patient.
Right.
Yeah.
And I think also too, as far as the education, this is a very obviously sensitive topic. Like I said, I feel privileged to hear each story, and I also think it's very important to educate patients and what's going on and why their bodies are reacting, potentially why they're reacting, and investigating and telling them and giving them choices. And those are things that I think APPs are excellent at doing. Taking the time and connecting with the patient and educating. And I often, like I said, spend an hour for females and usually 30 minutes for males. And I'm usually, I know you're laughing, but usually we will, charge them time. And we're still financially doing well. Again, because our surgeons in the OR and doing procedures too. That's another part of this whole thing. So, yeah. And so we're all, like you said, working at the top of our game and stretching and growing, which is great.
That is so good to see, because I think this is the model moving forward in any subspecialization, because we had this conversation with John in our first episode, and we talked about whether we like it or not, there would be a shortage of urologists.
Yes.
And the innovations are coming, right? The innovations are coming. So doesn't matter how many innovations you have, if you cannot deliver it, then how is that getting that practical use of all these beautiful sciences that are coming to make our life better?
Yes. Yes.
And I think that this is the second phase I want to get into this question is, like, when a man has androgen deprivation therapy for prostate cancer, their baseline changes.
Yes.
And to me, that feels like what probably women might go through when they're going through menopause. It's like a perimenopausal phase and a menopausal and post, And I think we are more aware of that now, instead of just saying, oh, okay, this is my age. Can you share some insights in that, and what are you guys doing?
Yes. I just want to say about the androgen deprivation therapy. A lot of patients will come in real quickly and they say, my wife says, now you know how I feel. I'm probably crying in Hallmark commercials too right now. So anyway, yes, we are doing a lot of things. I think there is a great push right now that there's a lot of social media. I think maybe you've heard some podcasts, I don't know, or just seen little tidbits on Instagram. A lot of physicians really speaking up about menopause. For heaven's sakes, Oprah Winfrey had a whole prime time hour or two on menopause just recently. And there's books coming out. And so women are really coming in and they're wanting help. They're begging for help. They feel awful. They feel crabby. They feel hot flashes, which we know now is the brain heating up. That can't be good. And more inflammation throughout all the blood vessels in the body. So not everyone has it, but I think it's an important thing for APPs to be educated on. I'm actually planning on taking a certification in menopause in a couple of weeks, so that I want to be at the top of my game in knowledge. I don't think I'm just going to solely treat that. Obviously, I'm treating sexual medicine, but that does play a role, right? Yeah. As far as GSM and pain with sex, or hormones going down, and maybe women not being able to have an orgasm, their libidos, they feel awful, they're not sleeping, their libido's low. And that's complex. There's a lot of factors that play a role in that, but I think it's very important and a special niche for APPs to kind of fill in the gap if that's a passion of yours. I know that when I go to the international conferences, the OBGYNs are saying they're only getting about 8 to 10 hours of training on menopause. And they're supposed to be the experts. And they're saying, wait, we didn't get trained on that. So really, we need people to stand up and to receive that education or be willing to learn and treat. There's just, a great amount of people starting to go through this. Back in the day, women only lived to be 55. And so that this was not an issue. But now women are living to be, obviously, 60, 70, 80, 90. Well, now, I mean, we even have centurions now, right? And women are coming and saying, this isn't acceptable. Stack perk. What do I do? What gets the option? So I think it's like exciting because I think that there's a lot of work to do. Like I say, I try to say one starfish or several starfish in a day, throw it back in the ocean. But there's a lot of work to do. And I tell you, these women are grateful because someone actually listens to them and hears their journey and what they've been going through. A lot of times they've been also too dismissed by many professional providers. So that breaks my heart too, because that shouldn't happen to anybody.
Right. Absolutely. No, this is so true because one thing is, I just think in general, with the hot flashes and that stuff that you have said, women tend to have a lot more higher tolerance and they don't really are not so vocal, right? From like anybody who treats prostate cancer, I know the first thing they're going to say is, oh my God, this hot flashes, and I see their wife sitting right next to them.
Yes.
And just looking at them.
Yeah.
Like what you mentioned,
Yeah.
And it is funny as I'm listening to you because you said you had 2 offers in endocrinology and I think you are still doing quite a bit of uroendocrinology now. So I think you are the best of both worlds.
I am, except for I'm not treating diabetes. So
Right. True.
looking out for that, but not treating it. Yeah.
And I think, is there some like non-hormonal approaches now too coming out for the hot flashes for women?
Yes, there are things that are off label that you can try to use. There's there is a medication, Veoza. I don't know if you've heard of that. There's actually even a app that you can download that helps with hypnosis that it has actually been studied in science and then has proven to bring down the hot flashes as well. So I think we're just starting down this journey of like looking at women like, wait, this is 51% of the population. Right. They count too. And now we're starting to treat them. So I think it's an exciting time to be an APP in this field.
I couldn't agree more. And it is also exciting and rewarding to have leaders like you in this field who are advocating for that. So that's amazing.
Well, thank you. Thank you very much.
So as we talk about leaders, I'm going to assume and say that you and I share an appreciation for John Maxwell's leadership philosophies, right? Especially his belief that true leadership is not about yourself, it's about influencing and empowering others.
Right.
As someone who has mentored like you at APPs and contributed to professional organizations like AUA, how do you see APP's leadership unfolding in sexual medicine and fertility care?
Well, again, I think that them stepping up and saying, hey, I'll help carry the torch. Like you said, the urologists are retiring in a large amount every year. And I don't think that we're getting as many urologists in training. So we need APPs to be standing up and learning and be willing to carry, maybe starting a clinic, or obviously receiving the education that they need to do that. So I think that's one way. I think just be an advocate for yourself is too, right? I know I was going to say that when I was in sexual medicine and started, there was a couple of females coming in, but not a lot. And they wanted me to see the females. Yeah. And I said, well, I don't have the training. And there was no one really there except for me at that point. Wow. And the urologist came in half day every other week. So I said, I will do this, but I need training. You got to give me training. Right. So they sent me out to Philadelphia to follow Dr. Susan Hellad-Spate. She's a well-known in female medicine. Another time I was supposed to go, or my colleague, the physician, got asked to go to do training for the Mona Lisa touch laser. And they didn't ask me. But I said, hey, it's going to be her and I doing this. I would like to go too. Right. So they did pay for both of us to go.
Oh, nice.
Yeah. So I think as far as being a leader, you need to speak up for yourself and advocate for yourself. Don't be nervous or shy about that. I think if they say no, they say no. But I think it's a good, because at the end they're going to need to depend on us to help them out, right?
Yes, no, I couldn't. And as you said, our urologists are also surgeons, and there are so many procedures that are minimally invasive or even innovations that does not require surgery, right? It requires, like you mentioned, explanation. And you come from a family nurse practitioner background
Yeah.
also.
Yeah.
So I would assume that you're looking at the whole person, not just that one aspect of it. And then you are kind of able to dedicate what is the need of that patient and kind of tuning it that way, right?
Yes. Yes. I look at each patient, I tell them, you're a big puzzle for me. And I'm looking at all these different pieces of you. You're complex, right? You're this unique snowflake, if my plate's saying winter's coming. So yeah, everybody is so different in what they need. And sometimes patients will come in and they think they know what they need, but you're like, okay, let's just back up. You get more data and again, educate, right? So yeah, it's a very fun field.
And I think even with AUA over the last few years, I think the dedication to take time in their conferences for APP has also grown because they are seeing the value added, So I feel like these conversations hopefully will spark throughout that APP should be a part of strategic discussion on the front end, not as an afterthought.
Yeah.
Do you agree with that?
Yes, absolutely. I think that's true. When I first started going to the conference at the AUA, there's only about 50 people. This last spring, there was 500 APBs. Actually, we had people standing in the back. It was Gore. Don't tell the fire code people, but yeah, this is again. I think the excitement is happening. I would also say it was very an honor. I was able to be on the Young Urologist Committee for a couple of years too.
Oh, wow.
So yeah, and in the large AUA leadership from like the Midwest, North, and so also we had a voice there as well. Our voice is very important to be heard because again, we're a rail inside them. We're a seam. So we need to voice our opinions and gracefully. All right. But yeah, work as a team.
Yeah, and I can attest to this because I was there at the last AUA and it was standing room only. And that was, and we actually have even urologists in our sessions
Yes.
that was there. And that's great, because I do think like it seems like I work with a group of urologists who really sees this that we are adding value.
Yes.
And they kind of because it's a mindset, I also think, but I think more and more the awareness is coming around. It's going to just keep getting bigger and bigger.
Yes. Yes.
The
I thought I think your mentor was in for your talk,
yes,
supporting you. So that's an example of like cheering on APPs, right?
yes.
I loved that. That was really cool.
So one other thing, I just think, today, like, so much information is out on the web, social media and other stuff, which is good because when people are coming in, they are seeing that, okay, I should do this, I should do that because Google told me this, or I have seen this TikTok, right?
Right.
One way it's good that people are taking ownership of their health. And what do you think? It could be a barrier too, because then it's kind of like me going to a mechanic with my car and telling them you need to just change the alternator.
Yeah.
Maybe that's not the real problem, right?
Yes. So I always say when patients come in, I'm like, oh, Dr. Google. Yeah. I said that's job security for me. Right. So and I just kind of giggle a little bit. And then I, again, will educate. Like, oh, that part, I could understand the part, but maybe this part over here. I think it's important as clinicians to know what are some good podcasts. to know what is a good website to go to or a book to read. So I will give my patients specific things to look at because they are hungry at QVA for information. So I don't want them to listen to some guy in his basement, but I'd rather them have some expert opinions that I feel that, as part of our field that like, okay, this is in line with medically, right? And science. So that's typically what I'll do. It. A lot of them will listen to those types of things or have their husbands even listen to some of the things. And so that's how I've navigated through that.
And that is so wise because you are still, not discouraging them, but actually guiding them to the really like peer-reviewed kind of stuff that they should take so that they are enjoying the benefits of that.
Right. You're getting correct information, right?
Exactly. Yes. I tell you, just talking today with you, I learned so much, so much, because it's really for me when you at the AUA are speaking, and I listened to you, I was at awe, and again today. So my question to you is that as we with Urology Times grow this podcast, what suggestion do you have for me or this podcast? How can we continue to improve this from your expertise?
Oh, I think having experts on in our field, right? The APPs I'm talking about, maybe the MNDs too, but I think because I think we need to highlight the expertise that we have. We do have expertise. We are vital to the clinics. So I think just tapping into that expertise and then that knowledge and I think that's what I would do. Tap into the leaders and people that you see that are good upcoming leaders. And sometimes we need somebody to also to believe in us, right?
Yes.
To be like, you can do it. I see this in you. So I think those would be the things that I would recommend.
Tricia, thank you so much for your time. I really cannot express my gratitude that you took time from your busy day. And so as we conclude, as we are getting close to it, so let me say to the audience, thanks for being a part of this journey. Your voice, your work, your passion, they are what gives this space real strength. And in our next conversation, we will sit down with another leader who is driving meaningful change at the grassroots levels. Until we meet again, take care of yourself and each other and stay hungry and stay curious